Greetings. My name is Rohan Kulkarni, and I lead the healthcare and life sciences practice here at HFS Research. Welcome to HFS Unfiltered, where we get to speak to other experts and dig deep. Today, I have Deryk Van Brunt, who co-founded CredibleMind and is its CEO. Deryk wears many hats, being the president and CEO of the Healthy Communities Foundation, a nonprofit organization. He teaches at the University of California, Berkeley School of Public Health, and is awarded researcher as well in the areas of individual and community health information systems. Deryk is also has an MPH in epidemiology and biostatistics and has a doctorate in health informatics from the University of California at Berkeley. Deryk, welcome.
Thank you. Glad to be here.
So let's just dig into this. And let me try and set the stage here. We're going to discuss population mental health today and how we can practically improve the mental health of the populations we care about. So as we do that, I think it's important for us to first get grounded in terms of what mental health is. And my understanding, and we'll get Deryk to chime in here in a little bit, but my understanding is mental health is a combination of our emotional, psychological and social well-being affecting our thinking, feelings, and actions. It essentially determines how we handle stress, relate to each other, and make certain choices. Now, the other thing that is of deep interest for me is that we must also address health equity and social determinants of health, or incorporate social determinants of health in our efforts to improve mental health. So, in order to do that, let's have a consistent understanding of health equity and social determinants of health as well. Health equity is the fair opportunity for each person to attain their optimal health, and social determinants of health reflects the conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life, risks, and outcomes. So today, I'm going to pick Deryk's brains on the research that they're doing at UC Berkeley and the work that they're doing at CredibleMind. So with that, let me first, Deryk, ask you the first question here. Mental health is a broad term that incorporates various conditions and diseases of different severities, such as depression, attention deficit disorder, bipolar, and more. In 2020, I understand that 1 in 5 in the US experienced a mental illness, while 1 in 20 experienced a serious mental illness, and another 1 in 5 experienced both substance abuse and mental illness. These are very disturbing statistics, if I might say. So let me ask you, how do you make sense of all of what's going on?
A lot's going on. First of all, I think what we care about is mental well-being. So just to get some terminology, mental health and or behavioral health is a little bit of a subset of a larger package of issues, which I think you very nicely summarized earlier. And because what we're all trying to do is flourish in our lives, right? So if we happen to have a condition, anxiety, depression, burnout, etc., that's very serious. We need to learn how to mitigate those kinds of symptoms. But what we're aspiring to is to flourish in our lives. Okay, so just kind of want to put out the North Star there. Mm-hmm. So what's been happening pre-COVID is that we've had some slippage around mental health in the United States, and I suspect broadly around the world. And it's been happening for a variety of reasons. And I don't know that anyone can definitively state, but everything from the dense, population centers that we live in, the pace of life with media and social media, the other kinds of concerns, especially for youth that social media brings around, fear of missing out, feeling lonely in the midst of seeing what everyone else is doing. So there are all kinds of macro factors, economic uncertainties, political uncertainties that lead to sort of an erosion of mental well-being. This is pre-COVID. COVID came, and I liken it to kicking the hornet's nest. The problems were already there. The inequalities in our society, they're already there. But what happened is COVID exposed many things. For example, what? I'm a person who doesn't have a lot of money. My job is what might be described as a frontline worker. I deliver packages in a truck. And I now have to continue to do my job in the midst of this pandemic and become exposed more than someone who's sitting off carefully in an office, or better yet, maybe working at home. And so it's a systemic disadvantage for many different people during COVID to be hit with the economic realities and the fear on an individual level. So long story short, jumping to the overall effect, COVID has, for certain conditions, tripled and quadrupled the rates of things like anxiety and depression. Burnout is all over the place, especially in frontline workers and healthcare delivery workers, nurses, physicians, et cetera. And so these things were there, but they've gotten worse. And here's the last statistic I'm just going to throw out. We've learned from looking back at like SARS, MERS, 9/11, that when you kick a hornet's nest around the mental well-being collective, and then the issue resolves itself, the mental health problems do not go away for another 3 to 7 years. So roughly speaking, if our listeners are the C-suite of an employer organization, or they have patients or members that they care about, or union members, realize that a couple of shots in the arm is not going to solve this problem. We've exacerbated a situation. It's very serious. It's hitting productivity, and we're going to be. We need practical solutions, because this is with us for the next 3 to 5 years.
So the harder we kick the hornet's nest, the longer it appears to take for us to kind of recover. So let me ask you about CredibleMind. What does it do? You and I spoke about population-based mental health. Just give us a sense of what do you do? What does that all mean?
So let me give a two-part answer here. So first of all, wearing kind of my UC Berkeley hat, I've been very interested in the quality of life in our geographic communities, and have been working in that area doing research for, over the last decade or so. And in doing that research, I found that for most communities in the country, and working with, health insurance companies, hospitals, employers, health systems, coalitions, United Ways, churches, et cetera, that what we found was mental health challenges and substance misuse was ranked number 1 or 2 as the biggest community-wide issue virtually across the country, okay? So I use that as an impetus to ask some research questions, and I'm gonna oversimplify it, but it was pretty much this simple. Is it possible to create an information system that would provide more prevention and early intervention around mental health, which we could add to what we already do reasonably well, which is therapy and medication, where you could put these together and essentially move from a reactive system of mental health care to a population-based system of mental health care. We've made that transition in the physical health world, right? So it used to be you get open heart surgery, patch you up, send you home. I'm being a little bit carefree here as I say that. But now there's much more attention over the last 30, 40 years in the physical health area around prevention and early intervention. Stop smoking, start exercising, eat properly, drink less, blah, blah, blah. So in mental health, we have not made this transition. We still wait. The average delay, Rohan, from when someone has early symptoms of anxiety and depression, as an example, to when they engage with professional services is 8 to 10 years, the average delay. So what do we do before all that water goes under the bridge? So CredibleMind, to answer your question, it's the only one-stop shop for evidence-based self-care, what someone can do on their own for all mental health topics. And it's something that an organization can implement, and then basically, for over 200 topics, people can just self-serve, if you will. But if they need more help, then it passes them through to therapists and clinical teams, whichever network our partner works with.
That is as succinct as you can get, I guess. Evidence-based self-care. That is fascinating. So, the other topic that you and I chatted about last time around was health equity and social determinants of health. I indicated to you that we are doing some work in terms of how to make commercially viable social determinant of health solutions so that the incorporation becomes a little more wider and the frequency increases. So question to you is, how do these play a part in population-based mental health, health equity, and social determinants of health?
Well, of course, a very big topic. And as you said earlier, when we look at health equity, that's kind of the holy grail, right? That each person can arrive and optimize their physical, mental, and spiritual well-being during their lifetime, that there's no systemic disadvantage to that based on where they live or the people that, are in their community, that kind of thing, what are called the physical and social determinants of health. And so fundamentally, there are two different approaches to this. One is a more political resource-based, and that is we have to make systemic changes in our communities. An obvious example would be something like redlining for home loans, right? If you're in certain communities in this country, banks are less likely to give you a loan, and therefore you cannot attain the same kind of wealth as other people. And these are communities that typically are of color, typically of lower means. And so that's more of a systemic issue. And that's through policy and the process of democracy that we need to make the investments in education, housing, et cetera, to make these improvements. Now, if you are the HR director or CEO of a company or of a health plan, that's a big issue to push. I call it sort of a big wet noodle. It's like you could push pretty hard. I'm not sure what you'll get done. So I think organizations can and should be on record and make those contributions in the societies and communities where they serve. But they can make a more direct impact. And it may seem counterintuitive, but for your employees in a white collar company, your employees they are not all equal with respect to these social determinants, social and physical determinants of health. So you can help them. And this includes issues like, if some access, some people just have less ability to go find resources to help themselves. Maybe they need help moving in a housing issue or through a job transition or whatever. So one of the things that we can do is provide access to resources through digital means that have to be available on the phone and all of this, and help people find other individuals, resources that help them through the challenges that they've got, which one would typically describe as a social determinant of health or health equity issue. So I think there's these two approaches: systemic, and help each individual find the resources they need more easily. Don't expect them to go work the system. They can't buck generations of non-access. So bring the access to them, ask them the questions. You can be proactive. Let me give you a concrete example. Mm-hmm. You can ask people, we know that to build resilience, part of what you need, which is very good. Any employer wants to build resilience in their workforce. Well, one of the elements you need is just a good social network. You need a network that you can count on if things go wrong, so a simple assessment where it's kind of like, how strong is your network? So you can see an image of your own issues and then where you might go and how you might strengthen that network. That's directly addressing what some people would throw into a community problem, but the individual can work on it as well. So it's individual and community, and we need to work both sides and work towards the middle.
So let me press you on that a little more, because in so many ways, health equity and social determinants of health, I find to be really good conversation topics in an academic setting or a non-practical manner. But I think you're beginning to pull the thread on some practical mechanisms in which you can actually use them, such as these social networks that you spoke to, or forums, for the creation of forums, for instance. But are there other practical ways in which you can really use them in the work that you're doing?
Well, let me tell you maybe just a little bit more about what we're doing, but some of the outcomes we're getting, right? Like, that's at the end of the day, what are we measuring here, right? So as I mentioned, we work with these host of different kinds of organizations, basically any organization that has a group of people they care about, like a university cares about their students as well as their employees and faculty. So what can they do? So when you help, and I'm just now on the path of helping individuals in their evolution. I'm answering your question here. I'm not on the systemic society change. Okay.
Mhm.
So as you help people understand themselves and find the tools to become basically happier people, and maybe they're doing this on behalf of themselves, or maybe they're doing this on behalf of people that they care about, a family member or something, then you're building that resiliency, and you absolutely can increase productivity at the same time, right? Less absenteeism, et cetera.
Mhm.
So things that we're measuring are people come into these self-serve environments, and it's not just about self-serve. Let me give you one statistic. 3 out of 4 people that have mental distress are interested in solving that problem on their own.
Okay.
So let's take that, and just to be, before I even dive into that, for the 1 out of 4 that actually really kind of need or are seeking professional services, obviously we want to help triage them, help them find appropriate care. And when I say appropriate care, that's a whole different world. That could be peer support, health coaching, therapy, medication. You don't just sort of jump to one thing. There's a whole stepped care approach to what people might be benefited by. But that's for a quarter. For the 3 quarters, you can provide them with evidence-based self-care, right?
Mm-hmm, mm-hmm.
So, and that covers everything from learning how to meditate, if that's what they want to do. I'll give you a concrete example. I have a family member who has suffered from anxiety. They've been medicated for that. Mm-hmm. Through our system, we learned they've seen a therapist, they've been medicated, and they didn't really want either. Through our system, we found there are 15 different things you can do on your own to reduce anxiety. 2 of them spoke to this young man. One was playing music. So now he plays about an hour a day of guitar. And the second is something called good sleep hygiene. And which means, you turn off your digital screens and this and that. But we didn't know that sleep was that directly related to anxiety. Long story short, those 2 lifestyle changes have been made. No therapy, no more medication, feels great. Evidence-based self-care happened in my own home. And it is a travesty that this information is not made available to everyone. So any employer, any insurance company or hospital, and it's not expensive because this content doesn't change that quickly. Mm-hmm, mm-hmm. So what we've really put together is this turnkey gateway that you can just implement rapidly, let everyone self-care, which by the way, saves you money, right? Because they didn't go on to more expensive forms of therapeutics. And then for those that need help, pass them through, they can take assessments, learn risk levels, and then triage would be sort of the technical term to professional services. So I hope that helps, but that's a concrete example of how giving someone information that meets them where they are in their journey, that might be culturally relevant, language relevant, it's not a one size fits all. There's no such thing. In our case, we vetted over 16,000 resources. So it's all mental health topics, but it's really trying to help people find what's right for them to make change. In the case of my family member, it was downloading an app to help them sleep. But how would you know that that's what you needed to reduce anxiety?
Wow, that's fascinating. It really is. You mentioned that you work across different healthcare market segments, employers, health systems, health plans, communities. But my question is, people are people. So I'm kind of curious is how does market segmentation have an impact on how you do work? Yeah.
Yeah, well, and again, sort of 2 types of market segmentation. So there's organizational segmentation. So the way our system would present to high school teachers and the kind of topics that are elevated and the information they get through newsletters and blogs and all of that is fundamentally different than what it might look like if we were communicating to students or seniors or something else. So there are organizational segmentation around how you can customize, because what this is about, Rohan, is engagement. People know that there are things out there that maybe they can do, but they don't engage, right? And they don't engage not because they're lazy, but because it's not easy to find. And even if you find it, maybe you try it and it doesn't work. So how many times are you going to bang your head against that rock? Not many. So instead, you got to flip the script and reach out and put, I call it the eye candy in front of people, and say something like, maybe it's an email campaign you got at work, and it says, how well are you sleeping? And it's like, it'll take 2 minutes, and it's private and confidential. And you'll know, you've always wondered, do you have sleep apnea or not? You answer like 6 or 7 questions. You get a low, medium, or high risk score. And depending on what your issue is, you're referred to resources that are immediately actionable and cost you nothing. Okay. So that's kind of, so that's a form of segmentation, which is by organization, which of these messages do you send out to gather the engagement so that people start using these tools and you gain the efficiencies and the more powerful, resilient workforce. Okay. Then there's the individual. What we've done as we basically go through all of these topics and resources is we've built filters, and I think we've got about 50 different categories now. So let me give an example. Let's say somebody has anxiety, but they're a parent. So we have a filter, which is parenting. So you might look at anxiety, but it's for parents, which now takes you to resources to help you with things like separation anxiety or how to detect anxiety in your child. Whereas if you're a student and you click the student button for anxiety, it's how do I get through exams and get over my math phobia, these kinds of things. So we have segmentation that covers different race, ethnicities, and cultural beliefs, life stages like age, types of media. I'm looking for a podcast because I take a train to work and I don't want an app. I don't want a video. I want to listen quietly to a podcast as I'm going to work or not. So it's an endless level, but we've got sort of tons of individual based profile filtering. And at the end of the day, we want to give the right few resources to the individual that's just right for them and where they are in their journey. Somebody says, I have a drinking problem. Okay, well, that doesn't mean they're necessarily a full-on alcoholic that has gone through AA 3 times. Maybe it's just someone who's kind of, in their 30s and finds they're drinking a little too much on the weekend and they're trying to find a better balance. The materials you would give to them versus the person who's failed through AA 3 times, or struggled through, I should say, well, that's kind of, these are very different materials. So you have to find where people are in their journey, what's their background, what's their interest, and line that all up. And then you get impact. And we're getting results. And I'll give you just 2 or 3 numbers if you're interested.
Yeah, absolutely.
Because no one's really done this kind of self-care on a broad base like this. So, roughly 90% of people that use our system report that it's valuable, they like it, they refer to a friend, those kinds of, lighter kinds of self-reported outcomes. But what we have found is that people say they better understand, this is about 3/4 of people say they better understand their strengths and their challenges. If you want to solve a problem, you got to understand the problem, right?
Exactly,
so,
yeah.
and over half say they've actually made a behavior change. Now, this is the holy grail on self-care, right? Ultimately, you want to tie this back to claims data and these kind of productivism. But for now, what we can already see is that people are making changes in their lives in the positive direction they want to take. And that, it just brings a smile to my face because that's why we all do this work.
Indeed. Fascinating. All right, so I'm looking at the clock. We've got a few more minutes. So let's skip to our very last section and talk about the future. So mental illness has been increasing in the US for close to 20 years based on some of the research that I've done recently. And it's disproportionately impacting teens, especially in the recent past. And you mentioned this earlier as well. The pandemic has made it worse. So what's your overall prognosis?
At any point in time in this evolution of the human species, people often look back and think, there was a book, The Good Old Days, just how bad were they, right? So who's to say really how it was 100, 200 years ago, or how it'll be in 100, 200 years. I can say a few things that bring some optimism to me, but I'll start with a couple of the negatives. We have obviously a very serious issue around our climate crisis. We've got serious issues around political divide. We have serious inequities. but we're looking at them. At least we're looking at them and we're talking about them. And what I have found, and you mentioned youth, and it's very interesting, our younger generations are much more open and receptive to discussing their personal challenges and those with their friends. And I take a lot of heart in that. I think there's really a great future in bringing more into our systems of education, into the workplace, just an openness to discuss these things and to recognize that mental well-being is not a given. It's not something you lose. It's something that you learn and you earn. And so I'm actually optimistic that we're beginning to really understand that. I think it's going to be a bit of a bumpy road, kind of to get there. But I'll just say one other thing on this. Because people, they ask, it's like, okay, so, somebody learns more, they learn how to meditate, they're more at peace, but what real impact does that have? Well, it has impact, of course, on the individual and their happiness level, and that's a win. But I think as, or even more importantly, is the human interaction. When we see the political divide, when we see racism, when we see these inequities, as an individual grows, mentally and spiritually grows, there is no room, and they begin to honor themselves, the relationships they have, and the environment they live in. You can't help but honor climate and the environment. You can't feel that way and then go ahead and continue some of the ingrained behaviors that we have, throwing away trash or wasting water or whatever. So I think that the hope is that, or a part of the equation, is to help each individual become as evolved as they care to, and then to nurture the fact that that will result in reductions in racism, that will increase, honestly, productivity at work, because you'll be that much more purposeful with your time, and honoring society, the political process, and our global climate. So I'm very optimistic we can become better as a species. We've got a lot of work to do.
That we certainly do. That we certainly do. Let me ask you one last question. You mentioned climate change a few times here. I do believe that climate change is the ultimate existential crisis facing us. I think it's perhaps 1,000x times the pandemic in terms of its ferocity. And our behaviors and the way we consume are all impacting health and healthcare, which is, in my opinion, is certainly driving some parts of the climate change. So just closing thoughts. What do you think? Where are we going next with climate change?
Well, I think I'm going to keep this in the realm of sort of the mental health aspect of this and spiritual growth. But I think, the other answer is just systemically, we can make the investments to shift, and that's much more of a political process. And, we have certain entire industries that are ingrained, and we need to wean from one to the other. And there are ways to do this with incentives and taxes. And, we're sort of doing it in a bumpy way. But I think that I'll pin it on this. I'll pin it on our listeners, to you and me right now. This is a leadership issue. We know how to help individuals self-care for their mental health challenges, and to begin to the degree they want to, not forcing it at all, grow sort of mentally and spiritually. And as I say, as a result, honor the earth and other people more, because that just comes with the territory, right? So it's like a skin, it's like a snake shedding its skin, right? It just falls off. So these negative interactions that we have with each other in society will slough off if we help people grow. And it's not expensive, and it doesn't take a lot of time. This is a leadership issue. Our leaders should be saying, we need to provide some self-care. It should be evidence-based. Let's get it out there. Let's tell personal stories. Some of the best successes I've seen is when a CEO or some C-suite says, I've had challenges. I took this assessment. I found out I was more burned out than I realized. I've taken some vacation. Don't be afraid of this stuff. Take the assessment. We like you. We care about you. Get involved in yourself. And we honor the privacy of that information. It's safe. It's secure. It's not being misused in any way. So I think that if leadership, the tools are there. The bottom line answer is the tools are there, and through our places of work, through our healthcare delivery system, through our education, we need to make these available. And I think good things can happen.
Couldn't agree more. Couldn't agree more. Deryk, it is a pleasure. I appreciate your leadership in this space, and thank you so much for talking to me about this. I'm sure a lot of our audience will also appreciate some of those insights and some of the direction that you provided us. So thank you so much.
Wish us luck. CredibleMind is we're a growing organization, but it's fun to be involved and make positive change. Thanks for having me.